says recording pending. There we go. So thank you all so much for joining us for the first Speak Up session. You're all, as I said before, star individuals, the chosen ones. No, that's a very grand way of putting it. But this is the first of 4 sessions for Speak Up Month. And they're going to be, each of them are going to be around certain topics, but this is almost the precursor for those conversations. We all hopefully know what speaking up is. I'm looking at Sarah and Joe for that predominantly, being two of my wonderful Speak Up guardians. But I'm sure each of us will know. Obviously, Gina is transient right now, so if you do dip in and out, feel free to join and leave as and when you need to, with your lift. And then, but yeah, so it's basically a conversation. I did a couple of these sessions where in my last role within UHS, and it was around just having a conversation. And often we put things on, we do sessions and we do meetings and we do action groups and steering groups and all sorts of other groups. And it sometimes loses a bit of that authenticity, I find, around just having a chat and bringing our whole selves to work and discussing culture. So I developed these kind of Teams meetings, and we all do them anyway, but it's just a discussion around some like-minded or not like-minded colleagues having a discussion around certain topics. Obviously it's Speak Up Month this month, so I invited you guys and you all turned up, which is wonderful on a Monday morning. And so the first of our kind of topics to run through is the easy one, which is what speaking up means to me. And we'll all have a personal response and we'll probably all have a professional response. So we'll probably go on both of those. So what does speaking up mean for the organisation, and what does speaking up mean for you personally? I know how things like this go, and everyone's probably no one's eager to be the first to talk. So I'm happy to say that what speaking up means to me is...
You know who's on this call, don't you, Dan?
I do. I am aware.
There's no one here that's afraid of speaking up, I can tell you.
I'm giving you the best credit possible. Yeah, you all put your hands up. Be polite. No, don't be polite. We don't need to be here. It's a safe space. No, so for what speaking up means to me, as the Freedom to Speak Up lead, obviously in a professional capacity, I want the organisation at all levels, all bandings, clinical, non-clinical, to have the opportunity and feel comfortable being able to raise concerns and issues, and in a positive and a negative way, because I do think, if something's making you feel uncomfortable and there's something inherently negative within the trust, we need to obviously ascertain what that is and be able to support people in being able to change that and give them and the trust a better opportunity for cultural improvement and speak up culture. But then there's also a part of me that's been thinking over the last few months or few years, really, that there's also, we focus massively on the negative within organizations sometimes, and actually there's a part of speaking up which is inherently positive as well, and enabling staff voice is something that we're really, really obviously trying to strive to do, and that may be innovations, that may be cultural improvements, that may be just pulling on people's personal values and being able to pull them out and actually have that as a trust shared value and a shared purpose. So that's what speaking up means to me. Who's the next in line? Joe, you're being so polite, you can go first.
Does that mean the others aren't being polite? So I mean, for me, it's about somebody saying to you, can I have a chat with you? Can I come and speak up? And they're upset, angry, unsure, not sure what to do about it, and just you have a chat with them, and sometimes that's all that's needed and they go away feeling better, or you can help them to actually take the process further. So it's about supporting staff and them just feeling that there's somebody that's listening, because often they feel that they're banging their head against a brick wall. They've raised it but they don't feel they've been listened to, or they don't know how to raise it. Or I mean, more and more I'm getting people saying, I don't know if it is freedom to speak up. And actually that's a good thing, because for me the edges should be blurred, because it's part of a process, not a thing on its own. And I was speaking to somebody last week who said, I don't know if it's speaking up or not, and I don't think it probably is, but that's not the point. He still needed some support with something. So that's what it is for me. It's just helping staff to feel better about something they're not feeling good about. But I'm really interested in what you said about actually just helping staff to speak up about things that are good and how we can we could perhaps progress that.
Yeah, it's got that negative connotation, doesn't it? And I think it's for a reason. I think, the history of freedom to speak up coming out of mid-staffs, there wasn't a lot of positives coming out of there. But I suppose the precursor to some of those things is staff not feeling heard. And that's not necessarily just about a negative thing. A lot of staff don't feel that, and we've spoken, probably everyone on this call in the past around, non-clinical staff, sometimes feeling that they don't have a voice, and where's the progression, and that's important as well, because that then can manifest itself into negative or unwanted behaviors from that person or from the team itself. Joe P, looking at you.
I just need to say that I was really excited last week. I tweeted my avatar, obviously not my real me, because I don't really like the real me on anywhere in public. And one of the people that liked my tweet was one of the ladies involved in the mid-staffs speaking up. So one of those people that actually spoke up. I don't know why I was so excited about it. It was almost exciting as when Mark Almond liked one of my tweets and retweeted it several years ago. Not quite as exciting, clearly, because Mark Almond is the pinnacle. I digress, and I realise this is being recorded.
So perfect.
please cut this bit out if you were sending it on anywhere. So for me, it's two things. So one, in my role as operations director, I want to know when things aren't good in my area. So I need to know how to fix it then. And if I don't know, I can't do anything about it. So it's really important to me then. And in my role as a guardian, I want to be available and approachable for people to come and talk to me, and they do. And when we first started, there were some real concerns about whether having too senior a team would make people not willing to speak up. But I've had people from, a band to apprentice and everywhere in between up to people the same grade as me speaking up. So I think it's about being approachable and doing what you say you're going to do. That's really important to me.
So yeah,
you're absolutely right. I think there's that. We've had a conversation many times. Again, most people on this call, I think everyone on this call, around the nuances and the differences and the similarities between, say, inequality or equality, diversity and inclusion, freedom to speak up, and then well-being as a whole. And there's so many similarities there, and a lot of that stems from action, not just words. And I know inherently in the past, healthcare has been guilty of not acting and speaking the right, talking the right talk, but not living by those actions, or certainly doing it in really small or siloed areas rather than it being a really call to action. So I think you're right. I think it is about living by that, and certainly showing that in your actions also.
I think it's not diluting it as well, isn't it? It's not just about living it, but if someone says to you, this is a problem, and we talked about this last week when we were talking at the hate crime meeting, that diluting something down to make it into just some figures, it is really dismissive for someone who's actually been brave enough to say, I think this is something that I need to call to people's attention. So it's about not diluting what they're saying to you when they say it as well.
No, you're absolutely right. Joe B, how are you today?
I'm good, thank you. How's everyone else?
That was Dr. Joe. I should address you as formally member of the fan club of Dr. Joe himself. So
I've been called worse, do not worry.
So what does speaking up mean to you?
I think I'm probably going to take it from a bit of a clinical perspective, if that's all right. So
please do.
For me, speaking up clinically has always been about you being part of a multidisciplinary team, and actually anyone in that team being able to turn around and say, actually, I don't understand why we're doing it this way, or why are we doing it this way? And for me on the wards, or for me in theatre, that's so important. And I think we've seen so many examples of when people don't feel able to either question what they're being asked to deliver or asked to do, or when the environment is such that they feel they can't. And I think that's when mistakes happen, and the focus kind of goes on to something else rather than the main cause, I guess. So I guess for me, it's about listening to people more than you're speaking, and really understanding the voices in the room about who's not being heard. and actively seeking them out. So you can say that in a team's perspective. I think now we're going a lot more virtual. I think that's a lot more harder to do. But actually it's about, if you're facilitating a space or an environment, actively seeking out who isn't speaking and actively encouraging them to speak up or to speak out about different things. So just recognizing whose voice isn't present in the room, even if they are present, they might not speak, or about who else do we need to include. And I think there's a second strand there about genuinely giving people the support they need to speak up. I think there's so often people saying, "Oh, I just want to say this to you," kind of off the, I don't want to formally raise this. I just want to, casually seek your opinion, or I just want to mention something to you. And actually, it would be lovely if we came from a place where actually that wasn't a thought, and actually it was just okay to raise something and say, actually, I don't understand why we're doing it this way, or can I just mention this to you because I don't understand it? And that's fine. I think it comes back to that phrase of not everyone knows what you know. And I think you've seen it so many times on different levels. We get a certain message at a level, and then by the time it either filters up or filters down, that message can at times be completely different from how it was aimed to be. And by the time it gets to those places, it doesn't make sense. And to be honest, if I was told to do something, some of the messages that have come back of what I've said has been like, no, I never said that. It's this. And then people understand it a bit more, and they're like, okay, that makes sense now. I understand why we're doing it that way, or actually that might be relevant for that level, but actually at this level, we're currently doing it this way, and the process might say one thing, but actually in practice, clinical practice, what we're doing is something else, and I don't think that's safe. Can we just tie up some loose ends? And for me, that's what it's about, really.
It makes perfect sense. I mean, you hit some really good points there around, the difficulty as well of dissemination of information. I'm going to go to Ems in a minute, but the difficulty of communicating things is incredibly difficult. It's a challenge, from and you're right, and there's almost that dilution of messaging when you rely sometimes on word of mouth, whatever that may be, or losing that the passion or the reason or the feeling of why something was initially brought up or initially raised or initially changed, and the difficulty then of that message then losing all of that stuff, and it just then at very best case scenario just gets down to a clinical operational change. The worst case scenario is it's completely muddied and it makes no sense whatsoever, which you alluded to then. So yeah, I think you're bang on with that, to be honest with you. Ems, what does speaking up mean to you? I'll put you on the spot there as well, because I only invited you this morning, didn't I?
You gave her a chance to think.
She's used to this, don't you worry.
Used to it now.
Yeah.
I think though, being sort of relatively new, completely new to a big organisation, I think for me it's a safety thing. So I know that there are people that I can go to if there was something that I needed to say. I came from a team of like 5 people, so that was really difficult in a way because everyone knew everything, and sometimes you don't want everyone to know everything. You want to say something, but you don't want it necessarily to come back on you. So now it's come into a place where there are measures and there are places that you can go to communicate those worries to people, and that it is not going to go anywhere, and something will be done about it in the best interest of yourself, not just the organisation as a whole.
Yeah, no, I think you're right. I think Joe hit a really poignant point there to me as well, is that isn't the feeling that I'll have an off the record chat, or can I have an informal conversation with you, or don't put this on record. That hesitance and that fear is the culture that we're trying to speak up guardians to almost diminish, in that actually if it is something that's genuinely worrying someone, regardless of whether it's in places justified worry, because we've all got anxieties about stuff that perhaps once we get the clear messaging, we probably wouldn't have any anxiety around, especially over this time, or certainly a lot less anxiety. But it's often that like hesitant to, I don't want you to think I'm unstable or vulnerable, or I don't want you to think that I'm not good at my job, and there's all the imposter stuff, and we could do a whole another 20-minute conversation on imposter syndrome, and actually the feeling of, oh my god, like I'm not credible, and I'm not the best I can be. rather than actually just being able to say, you know what, that doesn't feel right for me, like why, you know, and have that conversation. I think it's really important. Gina, obviously everyone will know the last name anyway, so I'm not going to say mom on a call, but you know.
You just did.
Oh, right, mom would do. I think for me, from a personal level, I think we talk about requiring courage and safety to speak up, and actually I sometimes think the higher up in an organisation you go, sometimes it is even harder, and you know, I don't think I've hid my light under a bushel about the fact that, you know, I was experiencing some very, very difficult situations in one of the organisations I worked in, and it was almost impossible to raise it because of where it sat in the organisation. So that was really tricky. So for me, it would be a dream come true for it not to require courage, because it's just become something we do. You know what, I've done this has happened, or I haven't done this and this is why, you know, and us be able to speak on an adult to adult basis with each other, rather than worrying about hierarchy or where somebody is in the organisation. So that means learning to accept the challenge. That means learning to, you know, take it on the chin when people go, actually, I think that was wrong. The thing you said there was wrong, and being able to deal with it. From a professional perspective, I mean, I think it's probably the single most important thing in terms of quality and safety, because I don't know what happens in a dental environment in North Hampshire. I don't know what's going on Fanshawe Ward this morning, but the healthcare support worker, the ward clerk, the porter, they know that stuff. So I think for me, it's about having 5,000 eyes and ears who were all going, actually, that's wrong. And as you know, Dan, you know, one of my greatest moments was one of my healthcare support workers, when I was a senior matron, came out of a room and said, matron, you're going in the room the wrong way and that's not safe. And, you know, I was absolutely thrilled to bits about that he felt that he could have the confidence and that he had the knowledge to be able to tell me not to enter or exit a room in the same way. So that was a big thing for me. So, okay, for professionally, it's probably the single most important thing that makes my job doable and makes our organisation safe. Yeah. I don't think that's too grand. I think that's what it is.
No, I don't think you'd have anyone arguably disagree on here. And I think we've kind of covered when I wrote out some of the stuff we could have talked about today. You know, there's when we say importance to speak up, what do we mean? I think we've covered it, especially with that grand last statement that it's the single most important thing. But I think there's a difficulty there, isn't there? Because, you know, like all things, we know what we could do. We know how we could change it. You know, we've got to encourage openness and honesty, and we've got to encourage vulnerability and the discussion of such. How do you do that, though? And that's the easy. The how is the hard part. The what we do is the easy part, you know. And I think for me, Leon's coming in with an amazing answer. I know it because he just popped in halfway through. But if I was to say to you, how would you, how do we encourage a culture of speaking up? How do we encourage a culture of openness and honesty? And that's to anyone.
I think we need to make sure that everyone feels their voice is valid. You know that I am the union leader for the non-clinical staff in the organisation. I feel really strongly that they are the people on the ground. We are the people on the ground who see things. You know, I understand that clinical is really important, and I agree with that completely. But it's the backroom boys, as we are, who really do see things and really know what's going on. So for me, it's really important to make.
You're so right, Joe. And you know what? It was non-clinical staff that were coming forward at the beginning of COVID going, I've got some concerns about safety here because I've never worn this stuff before, or I've never had to behave in this way before. And I'm not sure I feel safe. And, you know, it was wonderful that they had that voice, that they felt that they wanted to raise that. But I think it was a little bit of curveball because we focus on the safety aspect in terms of direct patient facing, but actually if you work in a kitchen, it's quite important that you know how to do that. We know from COVID across the country, it's in food preparation areas where there's been a bigger spread of COVID than in other clusters. So it's really important that they spoke up and said, we don't know how to wear this stuff. It's you know, like, what do we do?
It's even more subtle than that. If you think of receptionists and who are front line, you know, right there waiting for the patients to come in, and there's lots and lots of people. And I think hopefully that people do feel more valued after the day that we put on just before COVID, luckily.
It was.
And we are going to do a follow-up one, hopefully this side of Christmas.
So there's an element of celebration there, isn't there? Of like, you know, celebrating people's voices and their connection to the trust, I suppose, is another aspect of it. But again, it's like, how do you keep on a day-to-day basis or a monthly basis? How do you encourage it? How do we encourage honesty and openness? How do we do it?
By role modeling it.
Absolutely.
I think it's about role modeling and actually listening to yourself sometimes as well.
Yeah. I'd rather
listening
not do that.
So in a meeting when someone says the suggestion or someone challenges something, are you the first to be defensive, or do you generally take 3 seconds to just pause, think, and thank them and say, oh, I didn't think of it from that point of view, or oh, actually, thank you. I hadn't thought of that before. Or I'm really glad you raised that. How many times do we hear that in a meeting when someone raises a point? Or do we hear, like, within the first 5 seconds, well, actually, it was da 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 da, or I've done this because da da da. Let's just pause. Let's just think about the input that someone's given to that space and think, actually, that they've got a point there, or they've got some grounds there. And actually, I might not completely agree with them, but it comes from a place of curiosity. And actually, I need to understand where they're coming from, because not everyone knows what I know. So what do they know that's that I don't, and how can we encourage more people in that space to say that?
That's so good.
I think that curiosity bit is Joe is so vital. Exactly what you've said there. The idea of, tell me where that's coming from. Tell me, you know, and trying to understand their perspective of it, rather than, as you say, you know, there's sort of jumping in to correct someone, but also trying to understand, well, why do they feel that way? Because I think we all figure things out from our own perspective, don't we? In my heart, I'm still, you know, I'll still view things from a nursing and clinical perspective, but actually, if this ward clerk is raising this concern, I have the duty then to sit there and go, okay, so talk a bit more about that, explain a bit more where that's come from. It's really important. I like the idea of curiosity. I really like that.
Well, and I said this the other day around when we were talking about discrimination and acts of discrimination, and genuinely, like, if you yearn and you love to learn to educate yourself and learn to be better and learn to just culturally be more aware, then it's very, very hard to have your counterpart be, you know, and you be discriminative in that sense. It's not impossible. You can still be trying to educate yourself and be discriminative, but it's quite difficult if you're loving that learning and immersing yourself in different cultures and different opinions and just coming at it from a place of just feed me information I want to know, and being passionate about that. I think it's quite difficult then to go on the other side of that, which is not wanting that education and feeling like you are blinkered in, well, these are my views, you don't have to take my views. And it's like, well, no, because it's very difficult, isn't it? Because I think, as all things, I think from a lot of the time, if you do events or sessions like this, or you do events, you'll generally get the people that are up for educating themselves and learning more and wanting to immerse themselves. It's the people that don't come to sessions and the people that don't step up and say, well, you know what, like, I could be better, we could all be better, we know that. Joe, possibly not you because you're up there, but as I'm
Joe P
and not
Joe P
Dr. Joe, I mean, I am his number one fan. Well, number 13.
well, you're not, are you, actually, number one?
But Leon, you've just joined the call, and you're off camera, but you can go on camera if you'd like. I'm not putting you on the spot by any means. Or Leon's just being quiet. But if
Something
he's not,
in the chat. Dan.
No worries. I will have a look at that. But is anyone else? What is your ideas around encouraging speaking up? So it's really hard. We've talked about celebrating voices, and I think that's really valid. I think role modeling absolutely is, you know, it's really important that all leaders and not just managers. We're not talking about just managers anymore. We're talking all people leading by example at all levels. What else can we do? I mean, I've got one, which is consistency. If I'm honest, I think we need messaging and consistent messaging, and we need to be. It's all very well as doing an awareness event like this and kind of going, well, we've got freedom to speak up, here we go, and then going quiet for months and months. In the same aspect, you know, it's Black History this month. In the same aspect, that runs the same risk. You know, we do an amazing month and then it goes quiet. And it's about that consistency of messaging and living by that messaging. Leon, I know you got your hand up.
Yeah, sorry. There's something about feeling protected. I think, you know, if you're going to speak up at whatever level that it is, I think that in some cases there's this